Thank you, Chairwoman, actually. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and very good afternoon. My name is Masri, as been introduced by the chairperson just now. Sorry about, I don't know why I feel sorry, but I want to apologize because, as a matter of fact, though, you got the wrong time. This is where it's on Saturdays, 2 o'clock, you should be at home, but rather you just, listening about me talking about disability. First of all, very good afternoon to all professors, the dean, my good friend, also my beautician of my teeth. There are two people here. First, Prof. Fuad, right there, and also Prof. Ikmal. Yep. But if something wrong with my teeth, it's not their fault. It's actually truly my fault. I would like to say thank you to Dr. Masri Alis, also my ex-classmate, when we were in ITM back in 1998, if I'm not mistaken. And also Dr. Ilham, my children pediatric dentist, together with my family is here today, my Diana and also Humaira, that giving me support. I just came back from Kuala Lumpur International Neonatology Conference, was officiated by the Health Minister, so we literally just got back from Roy Chulan Hotel. Anyway, so it's not about what I'm going to talk, all those things, about talking about disability. I'm actually going to walk around, which actually I prefer, so after this, I will make sure that everyone is awake, then especially at the back. It's a custom, really, that the students, sit way at the back and then, chatting Instagram and everything. It's common. I understand. That's fine. I'll reach you shortly. It's very common. Don't you worry. I do that to my medical student anyway, so they know my style and my rules. There's no way that you're actually looking at your crotch down there, look at your genitals, apart from that you're looking at your phone, isn't it? That's fine. I understand you. Keep going. It's fine. You're probably tweeting. I don't know what is wrong with this guy. I don't know what is he talking about. That's fine. Tweet it away. Okay. For those at the front end, try your best to enjoy my talk today, if possible. If possible. Okay. I changed the topic actually, enabling disability from baby steps to big strides. Yeah. I'm a neonatologist, so I seen a lot of premature babies. Neonatologist is actually a doctor, initially a pediatrician. I subspecialize in neonatology. It's a care about premature babies. Premature babies whereby that started from 6 months. 6 months, in other words, then 6 months already delivered, and then 9 months. Yeah, so within that range, and then up to 1 month of age after they were born. Talking about birth and everything, I'm a bit worried about Dr. Ilham, to be honest. I said to her that if she deliver here, I'm okay. I'll be on standby. I'm worried about that person, When she actually looked after my daughter last week, she said, I'll be there, Masri, don't you worry. But you're about to deliver. It's okay. You're there, right? Yeah, okay. All right. Okay, anyway. So, what is disability? According to United Nations, it defined as long-term physical, mental, intellectual, or sensory impairments which interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. It's a bit mouthful, certainly, but you know yourself in terms of what is disability. There are many ranges of disability. There are physical, there are mental, there are a huge range, even intellectual. Okay? So, it can be detected and predictable antenatally. In other words, then before the mother delivers a baby, then sometimes we actually can detect a baby is disabled or not. How do we do that? I'm going to explore that. I'm going to tell you shortly. Okay? Disability may be congenital, then that is born with it, and acquired. Acquired happens along the way when they grow up. A lifelong impact on the child and also on his or her carers. Now, this is very important though, because parents play the most important role in the upbringing of any children, including a disabled children. Okay? It created a lot of challenges in everyday life. As you know that, for instance, a child got disabled, cerebral palsy, for instance, a mother, a father, or even siblings actually had to help the parents in order to look after that disabled child. Okay? Range of different negative emotions, including fear, sadness, and can be overwhelming to the parents. It could be troublesome. I always say this to myself though. A parent that actually has a disabled child, they can easily got good deed or sins. If they look after their child very well, they are easily got good deeds. If they do otherwise, it's an easy sin. Remember that word. Okay? Now, multidisciplinary intervention influences outcome in many. We're going to involve Associate Prof. Dr. Faza. She's going to talk about it after my talk. Education support, including emotional and financial aspects, are often overlooked. Okay, there are myths and stereotypes about disability. They said, you know, some people said that, well, you cannot live by themselves, they have to be independent, they are to be pitied. They cannot learn or go to school, they have to, you know, they have to be like, really have to be with somebody all the time, either with the parents or with the assistants, and then that sometimes creates a burden. Do you call it a burden? Would you call it a burden? Do you ever hear the mother saying that in Malay? I'm sorry, I have to use a bit Malay though. I know some Arabic people say that, oh, أنا لا تتكلم الماليزي, أنا تتكلم العربية شوية. All right, so, you know, do you hear a parent say that, kau ni menyusahkan aku je? Ever? Ever? Never, right? They probably wanted to say inside their heart, but they didn't. Why? Because it's their children, isn't it? Disabled child, whoever that parents actually have disabled child, is a massive challenge. That's why we as pediatrician and all the multidisciplinary teams and yourself, a health physician or care provider, a dentist, a medical student or dental student, you give them support. How do you give them support? You're aware yourself about what is disability, what kind of support did they need. Yeah? Okay. So now, this is quite common though. Cannot play sports. I tell you one thing. When I was in Ireland, yeah, thinking that, you know, Malaysians are very good in badminton. That's what we think, right? No. Oh, a bit support here. You know, I know that netball team in dental is quite strong. I was hoping there's also a handball team in dental, but for ladies and for men. Playing sports, you know, there's Paralympics. Yeah, and then they've been achieving very well in it. They can run. I tell you, when I was in Ireland, I was playing badminton. This guy only got one hand. Okay, one hand, the left hand is actually a fully developed hand, and the other one is like a claw. And then when he played the badminton, he used the claw to pick up the shuttlecock, and then he easily beat me in the badminton. I'm not saying I'm that good, but you know, to beat a Malaysian dude, so that's good, right? And then who's disabled now? Isn't it? Right, I never call him disabled, but he's a nice guy, absolutely. Using a claw, holding a shuttlecock, a very tip. He was so good. And then you're thinking that, if he can do that better than I do, why can't we? Right? So that's a challenge for you then. Okay? So, and they will never get married or have children. That is completely wrong. Some people actually say that, okay, you're never going to get married. That is absolutely wrong. Okay, ajar di tangan Tuhan, jodoh pun di tangan Tuhan. And then the girls think that's what the quote for today, jodoh tangan Tuhan. You're just going to wait. Right? No, you're not going to wait. You're going to find, are you? Now, nowadays they said that even girls can actually go and merisik or actually going to propose to men. Is that true? No, that's not true. You just wait. Probably up to 30 or 40, you never know. But, you know, it will come. Just wait. But if it's too late, then do something about it. Right. No offense to anyone, okay? Just you know, try to lift up the mood because it's 2 o'clock. It's time to sleep. It's aircon, everything. I have to say, I admire your auditorium. It's fantastic. Have you been to our auditorium? And you're going to say, yeah, it's lame though. Hey, and I say one thing though. We have television at the side. You don't. Do you know what my problem is now? If I actually forgot my slide, I have to I can't read. It's very, very big. Anyway, so, okay, the categories of childhood disabilities, I said to you, congenital. Can you believe it that Down syndrome, Patau, Edwards, no, you learn this in your basic science, right? Genetics, inheritance. You can detect that antenatally. Yes, you can. There are certain parts they can able to detect. And also that these kind of babies, they carries complications as well. There are complications, for instance, complex heart disease, gastrointestinal problem. This can be detected antenatally by scan. When they suspect a child with Down syndrome or Edwards, they usually offer genetic testing. That is like amniocentesis and also chorionic villus sampling. Now you have no idea. Anyone know what's that? CVS? No idea. Technically, they took a DNA sample in utero. inside the mummy's tummy, inside the uterus. And then I ask you again, what if it is positive Down syndrome? Why do we bother screening? Are we going to terminate the baby? Can I ask you, for instance, Allahu A'lam, okay? Let's say you're pregnant, you're only at the mid, 20s, 22, 21, yeah? And the doctor said, Puan, unfortunately though, the doctor shouldn't say unfortunately, we detected some abnormalities and we are suspecting Down syndrome. Would you terminate your child? Would you? Can I ask, would you terminate your child? Would you terminate in child? Would you? Second opinion, there you go. I believe this is a professor, am I correct? And then once the audience, nowhere near, and who are you then? Say it again? Fantastic, I'm going to talk about social worker afterwards. Absolutely, second opinion, absolutely brilliant. Now I'm going to talk about abortion shortly, okay? Right, that's the interesting part about it. Okay, now, and then acquired. Acquired, there are lists of acquired problems. For instance, infection. Why infection is a big issue nowadays? Because we have a lot of... Anyone? Anti-vax. You know what anti-vax is? Yeah, the people that want to, uptake the vaccine. Do you know how many actually we encounter diphtheria nowadays? Yeah, we actually got death recently because of diphtheria. Is how serious it is. Just a simple thing. Now, if the child survives, the child more likely going to have disability. For instance, due to meningitis, due to diphtheria, a lot of things. This is called the acquired. Who's at fault? The parents. I blame the parents. As a matter of fact, though, whoever do not, don't vaccinate the child, I just walk away. If they say that it's my choice, I said, you know what? I have my choice too. I'm going to walk away from you. Is it fair? So, what is the excuse that they give for people that is anti-vax? Tiada keperluan. There's no need for it. And I asked them again. Are you going to Hajj or Mecca? And they say yes. Are you going to take the vaccine? Yes. Very excited because I'm going to Mecca soon. And then why is that? Keperluan. Necessities. Why is that? Why there's double standard? It's just because that Saudi government make it compulsory for you, and then here it's compulsory as well. It's wajib, isn't it? I can get too emotional though when it comes to anti-vax. Honestly, very emotional. Every time I see an anti-vax, I just walk away. Kenapa tak vax? The immediate thing, I just... And they say that, doktor, berapa banyak kali dah sakit, that's fine. But if you say like, my husband, it's always my husband. My husband don't want to vaccinate our child. I said, why? I don't know. It's always the husband. We all know that, man, everything is us to blame, right? See, the girls are actually laughing away that if everything is husband, if the baby or the child is bad behavior, see, it's your trait. If your child is hyper, it's your trait, isn't it? Itulah nak sangat kahwin dengan saya lo. That kind of Anyway, so other thing, I'm going to talk about autism, and I'm sure you are very curious about autism. Yeah, blindness and learning disabilities. Yeah, okay, antenatal. I told you already about the advancement of all the fetal, and I can't really walk though. It's too far, and then everyone has to like turn left and right and look at me. There's nothing unique about this anyway. So diagnosis can be done. Fetal ultrasound. That's fetal maternal medicine. It can detect early of any abnormalities. Like I said to you, Down syndrome and everything then. Okay? And then they will perform amniocentesis, CVS, and then there's a Termination Act. Penal Code 574. Now it says here, abortion is not, or for fetal indication, is not sanctioned, but justifiable through Section 132 Medical Exception Amendment, where the continuance of the pregnancy would involve the greater injury to the mental or physical health of the pregnant woman. Now, let's come back then. Okay, I'm actually going to go down. let's come back then, okay? I'm going to involve certain people. Is that okay? Right. So just to wake you up then. Okay, I'm going to ask all these single ladies. Is that okay? Right. Can I ask who will be the most talkative here among all of you? You know, I usually pick up the one that is wearing the blazer, because they are the people that can. These people here. Are they representative? It says here, I am committee. Okay. Right. Can I get you, miss? Can I get you? Now let's say that. What's your name, by the way?
Ada.
Come. Just interaction, isn't it? I'm sorry to pick you up. What year are you?
Year 4.
Year 4. So the only student I know is actually, do you know Terry, by any chance? You know the Instagram Terry official? He follow me. I say, I follow you back. It's no problem. And every time I say, hey, doctor, it's like, hey. You know, don't say anything to him. Please don't. He's a nice guy. I really like him. Yes. Okay. Ida, isn't it? Okay. How old are you, by the way? Don't mind me asking.
22. Yeah.
Now, let's say, if you are the doctor, you got a mother that is 23 years of age, first pregnancy, and your scan detected there is a Down syndrome, very highly suspicious, absolutely high. And you offer her, you want to do all those amniocentesis and everything then, and it turned out to be positive Down syndrome. How do you respond? What are you going to say to the mother?
I'm going to say, okay. I think I will ask her to continue with the pregnancy, because according to our religion, yeah, I will tell her otherwise, not to.
All right, thank you, Ida. Right, okay, she said then, according to religion, our religion then, sorry for my ignorance for other religion, but certainly I know two religion in terms of termination of pregnancy. First is Islam. It forbid for any form of termination of pregnancy. That's number one. In Roman Catholic, which I used to work in Ireland, is a very strong believer of Roman Catholic, is also forbid termination of pregnancy of any sort whatsoever. Okay? But in UK, termination of pregnancy is offered to any mother that has, for instance, Down syndrome. But it's been a lot of abuse in that services because of teenage pregnancy. My record in Ireland, I don't want to say in Malaysia, is 13 years of age. Yeah, teenage pregnancy. That's how soon it is though. In Ireland, only recently legalized the abortion or termination of pregnancy medically indicated, because in 2009 there was a big incident where a staff nurse that worked in Ireland, that place, both the mother and the baby died because of severe infection. Yeah. You have to remember though, all of us were parasites. Do you know you were parasites? No. You only think that you're a parasite now, sucking all your parents' money, is it? Yeah, I always say to the medical student, you're all parasite. You used to be a parasite because you suck everything from your mommy's uterus. Do you know that? And you remain a parasite because you suck all the money. Well, technically, is like from your father. Oh, you admit. Okay, I understand, because there's no scholarship nowadays, isn't it? So, in terms of termination pregnancy, though, it's not offered. How do we know that that is going to be the only child that the mother or the parents will have? How certain are we? How do we know that the parents not going to be happy with that Down syndrome child? How do we know that she is not going to be tearful when she holds that baby's hand for the first time? How do we know? Who are we to decide whether to terminate or not? That's my argument. But if it carry significant risk of mortality to the baby and to the mother, yes, it can be used. Unfortunately though, sorry to tell you that unfortunately it's widely practiced in the private practice in Malaysia, termination pregnancy. Do you know that? Unfortunately, yes, there's a lot of them. Okay? So anyway, that is first, you can detect that antenatally now during birth. Okay, during birth then, they are, okay. I always advise all my students again, because, you know, most of your professors and lecturers already gone through birth. Always push hard and push well. You know what does that mean? Masa nak beranak, nanti beranak betul-betul. That is a simple word of saying it in Malay. How's that? You push hard and push well. Try to avoid cesarean section, because you're going to be exhausted. You're going to be really exhausted when you actually deliver. You can ask everyone. You can ask my wife, you know, going through 4 delivery. I always there, and she crushed my hands and everything. That's what the husband for. But unfortunately, when the husband see forceps of blood, you know who's the actually have the weak heart? It's the man. Man, see blood, boom. Have you ever seen man that actually when you do dental work and everything, blood coming out from gum, like, you know, just like fainted? Anyone? No, yes, see? Usually at the theater, the man will collapse first. So anyway, I respected all the mothers that actually really, really work hard to push us out, you know, to give birth, to actually to care us, to be who we are at the moment. So all respect to all the mothers in the world. Absolutely. Now, in order to do that though, let me ask you, anyone here that knows your birth weight? Yes, do you? Okay, go on then. If you're like 3 to 4, you're okay. If you're 4 above, you are very macrosomic, we call it, big babies. Menyusahkan orang. That is a macrosomia baby. You know what is the problem, macrosomia baby? They cannot come out. It was stuck because you're fat. And they say, it's not my fault. It's my mommy's like eat Indians, you know, McDonald's every day, kebab and whatnot, you know. So like every day. And the baby got stuck. My daughter here, 3.7 kilogram. Look at my wife, she's very small. But normal delivery, alhamdulillah, you know, she's very nice, she's very slim now. Yep. It's nothing going to reflect whether you're obese or not. Okay, macrosomia is because of the mother has gestational diabetes. That means uncontrolled eating. It's okay. People said what? Craving. You know what craving is? I'm eating for 2. That is the excuse, isn't it? Eating for 2. The baby's 4 kilograms. The problem with big babies, when they deliver, their shoulder gonna get stuck. It's called shoulder dystocia. Have you ever seen delivery before? Don't say YouTube, please. Don't. My gosh. No, don't say YouTube. See delivery for yourself. I've seen a lot of deliveries. Yeah. So when a child deliver and the head go first, but the common got stuck is the shoulder at the perineum. So it got stuck, and then the neck will stretch the brachial plexus. You learn about brachial plexus? Yes. If you got brachial plexus, then they're going to cause injury or paralysis of the hand. It's called Erb's palsy. Erb's palsy is called a waiter's tip. The position of the child will be like this. Say, give me tips. You know, that is the exact, no, it's the exact medical term. I'm not making things up here, right? So, I'm not saying that, you know, yeah, when I get married, I'm going to like really chill, not to eat that much because my baby going to get fat. No. Eat away, that's fine. I'm okay with that. You know, the problem is postnatal. How are you going to get down your weight? Yep, that's the problem. Okay, the reason why you have to push hard and push well, because we want to avoid this fetal distress and hypoxia. Have you heard about the terminology by the Malay? Lemas, bayi lemas, or drowning. We are all connected to our placenta. The placenta will supply us the nutrients, the oxygen, the blood, everything that you need. The McDonald's, whatever that is transferred to you. That's why that if you want to, you know, make, you know, babies are very smart. They say eat well. Can you believe it? I was raised in Rumah Stinggan. Can you believe that? Wow, very sudden silent. You can actually check with my wife. I raised in Stinggan up to 9 years of age until my place got evicted by Dewan Bandaraya Ipoh. I'm from Ipoh, by the way. And I said, like, Ipoh, Stinggan, ingat KL you got the Stinggan. So it got evicted. So nutrients, you know, my mother probably eat well and everything. Then, you know, how she raised me, of course, you have to appreciate your mother. And we coming back to hypoxia. If you did not push hard and push well, for instance, a problem where placenta got detached, there's no longer oxygen supply. and your child soon going to be born, going to be suffered from hypoxia. And what is the most immediate thing that you want to avoid getting hypoxia is your brain. Because if that suffer low or deprived of oxygen, it will damage your brain permanently. The terminology of drowning or hypoxia going to lead to hypoxic ischemic encephalopathy. We're going to be cell death, inflammation, okay? There's a lot of cytokine release. This thing is not funny at all, this thing, okay? Traumatic delivery. Shoulder dystocia, mentioned forceps venous delivery. Forceps. Have you seen forceps before? I know some of the front ladies going to say like, yeah, I've gone through it. Yep, easy peasy, lemon squeezy, man. Nope. Forceps head is so big. You know, some people said it's a blade of metal thing, and then you try to put it on the baby's head. Or don't do, if anyone want to go to labor room, ask me, let me know. I can bring you over. No? No takers? Okay, fine. Right. Right. Okay. Now, first few days, as neonatologists, as pediatrician, we do baby checks. We make sure that the baby health being is being well looked after. In other words, then we check the heart, head to toe. There's a problem with the head, the movement, hypotonia, heart, everything from head to toe. Okay? So all the things that we do is called screening. On top of that, we also do screening of two things for blood. First, congenital hypothyroidism. Second, G6PD. You know what G6PD is? Oh, you know. Why dental actually need to know G6PD? It's something to do with medication, is it? You're very good. Okay. Sorry, I didn't mean to underestimate you, honestly. Honestly, I'm sorry. Okay. Right. Okay. Normal health, good breastfeeding. Okay. Who's here, future mother, will not like to breastfeed your child at all? Raise your hand. See, nobody. So you know, the uptake or the breastfeeding rate in Malaysia is 90% unless it's medically contraindicated. You know, in Ireland, it's 60%. Only 60. Going home, 30%. In Malaysia, 90%. It goes down around 70%. You know why in Ireland it's actually got poor rate of breastfeeding? Why? Women work. Okay, I'll tell you one thing. Maternity leave in Malaysia is 3 months. If you do master, 2 weeks. Yeah, good luck with doing master and get pregnant, okay? I'm sorry. In Ireland, maternity leave is 6 months. My wife took 1 year. That's fine. They will not question you. The only thing you're going to give an excuse is breastfeeding. They allow you. 6 months with pay. And then you're going to say that, okay, that's it. I'm marrying an Irish guy. No, you don't need to. Just work there. I'm not. No. Don't say that at all. You know, the minister really gonna kill me. So try to brain drain the Malaysian people towards the. They got better pay. Hey. Just to let you know, yeah. When I was a houseman in Ireland, my pay is a lot more what I'm earning now. Yep, we were really happy back then. We're still happy with your ITM. Your ITM di hatiku, you know, all the time. I don't know why I'm not going to private, but yeah, I'm staying put anyway. So 6 months of breastfeeding. Usually the first mother actually fails significantly because they don't know the technique, they don't know everything. Then why is it important though? Because breast milk is the best. You know, if you want to open a can of formula though, think about it. It's good development for the brain, and you know, it's actually God's creation. It's tailored for your babies. Yeah? So try to breastfeed as much as you can, okay? Okay, complication like hypoxia, infection, or potential cause debility is not treated properly. Do you know, if a child, remember the lemas part, the hypoxia, there is a treatment. How do we treat it? Anyone knows? We lower down the body's temperature to 33 degrees. We hibernate the child. We cool them. We call it total body cooling. That is proven to reduce the morbidity and mortality with someone with hypoxia. We do that actively. And then I just come back from the conference, and they said if a child got hypoxic ischemic encephalopathy or hydrocephalus, they use mesenchymal stem cells. they inject directly to the brain, inside the ventricles. That is from Korea. And they try it already, and it's success. And if you come to Malaysia, there'll be debate a lot, halal, haram, and everything, indication, khinzir and everything, then everything. It's very ridiculous, isn't it? The vaccine is haram. It's the Jews conflict with things and whatnot, This is the government event to do something, but no, come on, nonsense, isn't it? Why you have to be like that? Anyway, okay, this is what I do. This is a picture that I took in Rotunda Hospital in Dublin, in Ireland, when I started to do my neonatal subspecialist training. Then this is a baby. It's a 28-weeker. To see how small this baby is? Yeah, it's only 800 grams. Believe me, the ladies though, every time I bring my medical student to NICU, inside incubator, right? And I said, you want to touch baby? Can I, doctor, can I? So they want to touch. And then I said, put your little pinky. The 28-weeker, 28-weeker is like what? 6 months plus, isn't it? It should be inside the tummy. And the baby start to grab hold of the finger, like, oh my gosh. No, they feel like, oh, she lost me. No, just a reflex. No, that's true. All babies, when you put the hand like, oh, you're like, oh, like all the time. But one of the girl like cried, like, oh my God, I want to get married soon. And then they went to obstetric. They see the women birth. No, I'm not marrying. Forget it. Forget it. I'm not marrying anyone. Nope. Nothing coming up from there. Nope. Not a chance. Anyway, this is prematurity. This is what I do. Anyway, you can see that the child is being supported by a ventilator. There's an endotracheal tube. And that is the nasogastric tube to feed the child. To feed the child. A child that is a small premature baby, they are not able to suck and swallow. They have no coordination up to 34 weeks of gestation. Their lung is very weak. They're not mature. Everything is immature. The brain, the liver, the gut, everything is mature. But, believe me, on this stage, even 6 months of pregnancy, then you can express your milk and give your milk to your baby via this particular tube here. Yeah? They will tolerate and they will grow. For some reason, that's God's creation, that the breast milk tailored the specification of the baby on that stage. You know that this baby requires a lot of higher calories than any other people, including us. You should start calculating your calories though. This baby need a lot of calories because they need the fat. We don't. Right? If you got excessive fat, get rid of it. No, not liposuction. Yes, we have liposuction service if you want in CTC if you want. If you want. Only medically indicated. What is the indication? I'm getting married next week. Right, that's not, yeah? Okay. Right. Okay, they're not ready for real world. They cannot control their temperature, their regulation of heart is very poor, their kidney is very poor, they can't really pee, their gut is very poor, the brain is very easily fragile, got burst and lead to hemorrhages. Okay? So a lot of support needed, oxygen, feeds, antibiotics, and thermoregulation. Thermoregulation, that's why you got the incubator. A child not able to regulate their body temperature at all. They cannot, because they got large surface area to volume ratio. They easily vaporize the heat. If they don't control the heat, if we don't control the heat though, they're going to utilize the calories to burn into heat. Like at the moment, you're very cold, right? How do you utilize this, your heat? You burn your calories. Is it? Or you eat vegetables? Come on, cow eat vegetables. It's not thin at all. Like very, very strict vegan. Anyway, so complication, infection, intracranial bleed, lung problems. Lung problems is so important. Lung problems. If your child is suffer from lung problems, cannot breathe by themselves, it will lead to hypoxia. Hypoxia will lead to cerebral palsy. Okay? Okay, they're exposed to hypoxia, deprivation of oxygen. Main component is to monitor this. What are the three things is very important in thermoregulation? First, oxygen, glucose. Glucose, you know yourself. If you got someone fainted, yeah? You have to suspect whether that person has hypoglycemia. Have you ever seen someone fainted before? I'm going to start walking again. I get bored actually, and I'm a stage fright. So, have you seen have you seen anyone that fainted before? And they got bracelet that says diabetes. And then you just, rub something and glucose and then they wake up again. Similar as child. If a child, they don't faint, they present it with seizure. Sawan, absolutely. They're going to present it with seizure, and then that is not only that. If you don't abort that, it will actually ruin the brain, the white matter, and that will lead to cerebral palsy. So you have to be meticulous in oxygen, thermoregulation, and also glucose. Yeah? Okay. It's a long journey. A typical neonatal will require at least 3 months to be in NICU. 3 months with full supportive care. Every day, in and out, the mother come over. Do you know what's the beautiful thing that I see every day? Is that seeing both of the parents put the effort to go and walk inside together, and the father bring just a small pot of express breast milk. To me, that's goal. Not like goals, like relationship goals. That goal, G-O-L-D, like goal, like this thing. Yeah? So that is goal. Because mother's milk is the most important thing for the baby, for in terms of immunity and to grow. Absolutely. So this is very, very important, okay? So after they go out from the NICU, they have to be followed up. Yes, I run clinic for the development clinic. So it'll be up to 2 years. So we have to monitor their development, their growth, everything, head to toe, because they can encounter problem. Cerebral palsy, you will not see it at birth. You will see it when the development progresses. In other words, if there is a damage of part of the brain, then you will not see it until you discover that the child will not able to walk or they are limping. That is when you said, oh, there's something wrong at that particular part of the brain. So CP, you will not see it until later. Did you understand that part? They all look physically well, but until their development arise, and then you can see that they're not developing well. My advice, for instance, is someone less than 1 year of age, they are left-handed or right-handed, there's something wrong. Because they are smart, they're not using their right hand, left hand. Because my right hand is a problem, I cannot open. So the left hand, they pick it up with left hand. So less than 1 year of age, then they got hand preference. You have to be careful, yeah? Just be careful. Don't say, oh, cerebral palsy. No, don't say that. Okay? So if this need of rehabilitation referral, do so. We do have it here in UiTM Sungai Buloh. And then there's a great services been run by Associate Prof. Dr. Fazza's team. So she will tell you about it shortly, okay? Okay, NICU graduates and support organization. There's a lot of support though. They have the team, they have their WhatsApp group and everything. Then there's recently last week, it was World Prematurity Day. Do you know that? There's a lot of days. Doctor's Day, Dental Day, Social Worker Day. Is there such thing? I don't know. There's a lot of days. Teacher's Day. Okay, can I ask you, when was the World Kids Day? Say, only a mother knows. None of you we're not kids, man. We are teenagers. Some of you either 22, 23, and then you say that, oh no, my friends all get married, I'm still here. Embarrassment, isn't it? Once you receive a wedding invitation card, you should feel old already. Yep, that means your friends is actually inviting you already. Okay, I'm going to share a couple of things, yeah? This is my miracle hero baby. This is with the permission of the mother, allow me to present in different stages. This baby, actually, I first encountered in NICU in Hospital Sungai Buloh. This baby, antenatally, been diagnosed with this. It's a stroke. See that? All accumulation of blood. Yeah? This is all blood. So, you can see that antenatally. So, they delivered in Hospital Sungai Buloh, which is the correct place, because we got neurosurgical team. And you know what? The father worked in that department too. Ironic, isn't it? The father himself worked at the neurosurgical department. He's not the doctor, but he's one of the workers over there. Yeah? So this baby detected that, postnatally developed seizure. You expect that because there's an insult. There's something there, it shouldn't be there. So it's an insult. Yeah? So you can see that this is on the left or right side. You've been taught radiology as well, right? Yes, you should. Right or left? Everyone's like, hold on a second, aku bawa kereta pergi kanan, tak pandai lagi. Is it left or right? Right, okay. So, the right side then is actually got hemorrhages then. You can see there? Yep. See, this is from the antenatal scan then. It shows that the problem with the brain. Okay? This him, look at this. It's one of my early babies that actually, when I started UiTM, I invited him to be follow-up under me because I know that the services that we provide here is quite enough to look after this baby. What's this? Is that normal? It's a hand in fist, isn't it? It's part of cerebral palsy sign. But we try to minimize that, and he actually able to use it with a hand. We are training the brain, say that you should use your left hand. That is the job of the rehabilitation. I refer him as soon as he discharged from NICU. As soon as that is our miracle baby. That's the mother, and the mother actually is very nice, work with the government servant. That's the father. This is all my medical student. My medical student is a bit chirpy though, like, you know, like that kind of way. There's a lot of kunyits as well. They are very good dancers though. I'm sorry you lost in Virasa. I'm sorry. I'm really sorry. I was there. I thought the dental performance was very good as well. It was very good. But I'm sorry you lost. I'm sorry, honestly. I thought you were brilliant. Your supporter was brilliant. You were like at the stage. You don't see me, isn't it? Because I'm not significant, that's why. Anyway, so like you were brilliant. I was like, oh, they must gonna win it. And then see all my dancers, you know, they're all like bunch of, you know, Nats, Miru, you know him, Asif, all my dancers. They are year 4 at the moment. Thank God didn't fail anything though, but they were brilliant, yeah. But try harder, inshallah you win this year. Hey, no, we're not making any war in between, okay? I love dentistry. If people say that, are you one of the dentists? Yes. Do you know any of this? This is no. Anyway, okay. So this child is actually making good progress though. He can walk, but he's limping. He's limping, so he needs a bit of orthosis. Okay? But his brain, his IQ is perfect. Yep. But what kind of problem you're going to be encounter? What? What if this child go to school? Now, all of us admit that when we were at school, if you see someone that has got a problem, then you tend to mock them, bully them, right? That's the problem of disabled child. Even applying for OKU card, the disabled card, yeah, it's like something as a embarrassment. But fortunately, though, that entitlement carries a lot of benefit, yeah, for health services. So especially health services, yeah. Okay, I'm going to touch about autism. Now, usually at this front area, be interested, but the back area usually at your niece or your sisters. I don't know. Probably your mother has another child. I have no idea. Honestly, though, it can happen still, right? Most of your mothers will be around what? 40s, early 40s, yeah? Can you imagine then? I'm going home. Why? My mother's giving birth. Oh, it's so cute. You're going to have a baby. Anyway, so I'm going to talk about autism. But before I go there then, see this poster. I love this, but it's a bit complex. But I love this. I love this. You know for the fact though, a lot of referral that have been done in the development clinic is speech delay. They don't talk. Yeah? They don't really talk. Why they don't talk? Because they've been interacting with the phone, the gadgets. Why? We actually at fault for that. Why? We got distracted. Okay, we want to do work. We want to do a lot of things. And then we just give the phone. We give the phone to the babies and they say, baby shark. That is just lovely, isn't it? Baby shark. You all love to sing that, right? Yeah, right. You never watch it though. Have you like seen a pediatric patient? Yes, so do you talk to them? So, you talk. When you talk, you kneel down, right? Yeah, that's what you say. No, they already kneel down. It's on the chair. So we kneel down. No, if you expose your children to a lot of gadgets, though, the only interaction is with that gadget. It's no human interaction. There's no eye contact. There's nothing that interact between you and your children. So that is a problem. If you got a child that is speech delay, for instance, 2 years of age, not a single word, you ask, how long does a child exposed to gadgets? Can you believe that my son, you can ask my wife again about this, he loved Robocop only in Russian. You know, I'm not surprised that Niet or Da, I can speak Russian now. You know, and then all this weird thing, because they know. Have you ever seen a child at 2 years of age, give a phone, yeah, automatically he will find YouTube, whichever folder you hide it, and they will know with history. You know, so they actually love that. And the common word now is not mama or dada, whatever, it's ABC. You know? So where are the time that, you know, our parents raised us up, you know, playing in the longkang and everything. Yes, I used to play in longkang before, unfortunately. But I love it. It's exposure outside. Because we're so worried about the condition of kidnapping and everything. So we worried. So we just give tablet because we are so busy. We're busy with life and busy finding money. But the money's all gone anyway. Don't know where to. But we are so busy, we got distracted and just give a phone, they shut up and you're happy. Right? Phone is something that actually has been, you know, taken us away with communication with our children. So guys, less than 2 years of age, do not give any gadgets at all. Yeah? Please. Okay? So, in autism, you detect early. You look at them. And they usually say that they are weird. They play by themselves. They're obsessed with one thing. They're obsessed with wheels, for instance. You know that fidget spinner? They love it, aren't they? Yeah. So things that you see that is so obsessed with certain things, then be careful. But don't go on and say like, my son is actually obsessed with wheels. I think the child has autism. Don't say that. We have to see the whole development. Can the child see you? Can the child has eye contact? Is it appropriate smile? Is it appropriate behavior? Because autism is a lot more social problem rather than anything. Yeah? It's a social problem. Social development. Okay? Delayed speech is a lot more isolated. Why is it isolated? Because we're giving gadgets. And because we're not talking to our child. Because you let the gadget to talk on behalf of you. So there's no eye-to-eye contact and they're not interested in, they're more interested in terms of the gadgets. Yeah? Now it says here, no screening time television gadgets for less than 2 years of age. That's the truth. You don't let them. Yeah? I'm at fault too, though, I have to say. Can you imagine that my son, again, I'm going to tell you all my story, though. He knows stay young, man. Ear, nose, and mouth. He loves that. Who's to blame? I have to say myself, though. This is myself. Okay? So that kind of way, that the exposure, but we don't let as much as possible, though. But some of us that we need to get like a time off from them, and then you tend to just give it away, though. I'm at fault too. I'm not perfect. I'm not perfect at all. Nobody's perfect. Yeah? So no screen time television gadget for less than 2 years. Early intervention service is actually there for you in order, if you're worried. But do not come late, though. Usually the parents will not realize it until someone else pointed out. And they're going to say, anak kau ni okay tak? Everyone keep looking. You know, out of the crowd, though, he will not or she will not talk or play with anyone else. And you start to worry then. Okay? Yeah, sure thing.
No screening time. The no screening time, can we sort of say minimum?
The word no is also you know, boleh pergi tak? No, I'm doing it. No. Well, that's from the research that says then completely no. Because once you're actually exposed to that, then they're going to have addiction. You're going to have explore, curiosity, wanted to, you know, they got addicted because it's on their hand. Even us, we're addicted with a lot of social medias and phone, right? So the children, they are full of curiosity. They wanted that. Once you're exposed, that's the end of it. So how minimum is minimum? That's my other question, isn't it? Yeah, well, 6 months they don't know anything, though. When they start developing their development, start to hold, they're able to transfer objects, they have the pincer grip, okay, they can point, they can actually scroll everything, and then that is the time that is no. Well, the rest of them, that, you know, if it's 6 months, you're going to watch what? They're not going to watch anything, isn't it? And all the parents say, tu, tengok tu comel tu. They know nothing. It's you that wanted to see, it's not them, isn't it? Yeah, it's always you, isn't it? Oh, tengok tu cik ta. Oh, Fatah Amin ko. You know Fatah Amin was here in CTC? Fatah Amin Fazura. And Fazura and Fatah Amin was there on Friday. But my wife said, no, we're not staying. It's okay because we have something else. Fatah Amin, who else the other one? Who was here in CTC doing the Heroes on Cinderella? That's your time private. Did you not see my shoulder come out? Yes, it was my shoulder appear on the television. It was. I was the medical advisor. No, I was the one that put the Branula in Fazura, by the way. It was me, yeah. And then you don't want the neck collar to be on top of the head and, urinary catheter inside the nose, right? That's what they asked. Michael Ang was fantastic, though. It was a good experience. By the way, if you want some info about that, who's that guy? Who's that buff guy? Aurora kind of guy? Who's that? Faizal Arifin, is it? Who's that? He meant to be there, but he didn't came, so he said that, no, boring. Yeah. Amar Bahrain was there as well recently. So I'll keep you posted then. I know all my medical students is all about the artists, isn't it? Yeah, all these lecturers, they will watch only Astro Awani. Oasis, absolutely. Azan, no, change. Right now, change. So talking about screening time, it's okay to expose like Quran and everything, then Bismillahirrahmanirrahim, the things like that, then good, Alhamdulillah, Azan. They make dua and everything is good, right? We actually try to encourage them, things like that. Not go on like, whatever, Fatah Amin. It's no fun. Papan, good. Anyway, don't say that I said that to you, yeah? Okay. How are we going to manage this? How are we going to manage this? We're going to manage this according to multidisciplinary, yeah? There's pediatrician, there's a physician. Social worker is very important. Yeah, we got a lady there, she's a social worker. Right? Why is it important? Do you think that people in OKU or that got disabilities have no problem in terms of financial, in terms of support, in terms of even worse, the parents doesn't want the child? Yes, it happens. In Hostel Sungai Buloh though, there are certain parents, no, my child is disabled, I don't want my child. So who will look after them? There are people out there, regardless of the condition of the baby, willing to take that child as a son or a daughter. It's their job actually to advertise or like to promote this child, but they will have to carry the package as the child is. Yeah, if it's cerebral palsy and everything, and are willing to commit themselves to look after the child. Yes, there are the people that I so-called a noble heart. I don't know how they do it. Okay, so financial support is a big problem, unfortunately, though, because here in Malaysia, though, yes, we do have certain financial support from the social worker. There's a Jabatan Kebajikan Masyarakat. There are Zakat Selangor, for instance, but Zakat Selangor is depleting in their kitty bank. They are very tiny. I don't know what, I never dare to ask, but I think one of the causes is because of the high price and the demand of the money. Yeah, please pay your zakat. Please, it's your kewajipan that's compulsory, right? OKU application, like I said, be skeptical of being said that, oh, my son is OKU. But nowadays it's different because you accept that. You can see the facilities. You got OKU. Parking, for instance, OKU chair to accessibility and everything. But the only OKU people sometimes cannot use that facilities. The OKU, something else, that park the car over there, being stupid enough to actually to park the car over there. So selfish, ignorant. Yeah. Okay, the family support then. Family support is very crucial. Facilities, OKU friendly, I told you, yeah. Family support again, parents' involvement to do the physio and everything. Okay. Now, pediatric rehabilitation, I'm going to cut it short then. Okay. We select the best intervention. For instance, physiotherapy, OT. Okay. We do have a wide range of disabilities that we try to help. Spina bifida, they got post-meningitis, brain injury. Can I talk about brain injury just a tiny bit? Do you realize child abuse is a lot in Malaysia? Yeah? The child, usually around 6 or 7 months of age, usually attended with seizure. Was well, vomiting, seizure. No bruises at all. No fingerprints. No cigarette butt or cigarette scar or biting physical abuse. But usually presented with seizure. Why? Shaken baby syndrome. Lift up the baby and shake the baby vigorously to shut up, because the child will not shut up. And usually occur when? While the parents are not around with the babysitter. This is a common thing that I've seen. Is very upsetting, to be honest. Now I ask myself, would you trust anyone else to look after your child? That's a common disability nowadays. They got massive bleed because the whiplash, okay? You've seen in social media, right? A child whiplash front and back, okay? And will tear all these blood vessels and causing bleed. And they presented with seizure. And when they got seizure, the bleed actually has to be called out. And by then, they already developed disabilities. What are you going to do with a person that abused a child? We're going to do a police report, but most of them, we cannot able to identify who's the culprit. Can you imagine that your child, 6 months old, cry continuously, want the mother or wanted the feed, and be looked after by a carer that got another 6th child? How are they going to silently do it? They're going to shake vigorously. Puas hati aku. It's very common, ladies and gentlemen. It's extremely common. So be careful in selecting in terms who you're going to choose in terms of who you're going to look after your children. Okay? Okay? Right. Now, OT is to provide, there are the therapies, okay? OT, fine motor, we have all this in UITM. Okay? Fine motor skills, daily activities, behavior and coordination. This one is very difficult. If you got a child with autism, they're going to actually go jump around everywhere. It's very difficult and it's very mentally exhausted for the parents and for the therapists. But they have to have developed patience towards that. Okay? Speech therapists, we have that. Buan Farah, she's alone. All by herself, Lone Ranger. Poor her. But every time the UITM student come over, from outside, the faculty kesihatan, okay, they will help her. Okay, they are for language and expression and also reception. Okay, physiotherapist, movement, we know physiotherapist is very good in terms of movement, deformity of muscle, joints, pain and management. A lot of us actually went to physio before, right? Even including myself. I hurt myself during playing futsal. Yes, I'm old. I get it. Right. There is public and private practices. Private practice are able to go up to come home, but the session is quite expensive. 100, 150 per hour. But believe me, parents will do a lot of things for this. The practice out there is wide. Okay? Now, there is early childhood intervention, early identification, assessment and planning, provision of multidisciplinary services. There's a class of small people, and there's everything's under one roof. So they provide all the facilities. So the parents doesn't have, just parents go to the one center, everything is there. Okay? Now, do you know any availability of this interventionists? You know, talking about interventionists, though, I seen a lovely thing. It's called In the Beginning. Have you seen that? In the beginning, you know. What's the problem with saying in the beginning? You can see, the front people have no idea. The back people say, yes, that whoever that, the African guy in the beginning, in the beginning. You should look at it though. It's funny though. He got frustrated. It's in the beginning. Anyway, so they are the interventionists. Okay, Spastic Children Association for Cerebral Palsy. It is there. They take from 2 months of age. Yeah, Kiwanis for Down syndrome, KDSF that located in PJ, National Autistic Society of Malaysia (NASUM), Pusat Pemilihan Dalam Community. This is quite late. Now, in community, in other words, in UK and Ireland, they have home therapies. You know how hard it is actually for parents to travel with wheelchair? Very difficult. Yeah? A lot of parents defaulted their TCA because no transport. Simple as that. Okay? School with special education, OKU status, tax benefits. They have tax benefits, okay? Allowance when reach school age and equipment's free medical services. But again, this is the thing, some parents say that I don't want OKU. I can afford it, but believe me, they want to. They have to take it because at a certain stage then they have no money, run out of money, and they know the financial burden is so high. Okay? Many government schools in Malaysia will have special education class. You know this. There is sekolah khas. Yeah? You're aware about this, right? So there's sekolah khas and everything. Okay? Now, how do you prevent disabilities? It's sometimes quite hard though, prevention. Yeah? You can say genetic counseling. Now, for instance, all Down syndrome, all trisomies, the parents will have to go for genetic counseling. They check for the parental blood, and they will decide in terms of recurrence. Yeah, for someone that have Down syndrome child already, the recurrence rate is quite high. I seen my friend actually has the first one has Down syndrome, but the rest of the three hasn't. I also seen a midwife in Ireland have 4 Down syndrome child. 4. She know, but we did genetic counseling. Like it's only by chance, but by chance it's 4, all of them has Down syndrome. And she loved all of her child. Who are we to tell that this is, oh no, we should terminate and abort the child, isn't it? Okay? Right. So, and then there's a good parental, antenatal and postnatal care, national immunization program to prevent all preventable disease, avoidance of uncertified medication, teratogens. I'm scared of this though. I'm very scared in Malaysia. How many times we see a lot of medication that promote this, nak cepat bersalin, nak cepat jadi tegang balik and everything like, what is that? You know, there's jamu this, jamu that. But please choose the one that is certified by the KKM. You know, don't buy certified, buy testimonial. Ladies out there, you are like in the future of all the social media. Please be careful. Please, if you don't mind. You see this, there is a kid with autism, then they have to, they're performing. A lot of child with autism actually do well afterwards. You just need to early intervene them. Okay? The facilities, wheelchair, appropriate and custom design. A lot of child with cerebral palsy require a custom-made wheelchair to support their back to prevent from scoliosis or contractures. Yeah? Okay, public transport and accessibility. Okay, we are getting better in that. You can see there's a track for blind people, yeah, in Tesco. And you say that, siapa lah bodoh letak ni, macam mana aku nak tolak troli? Janganlah. You know that you want to cross it, the trolley got stuck. Right? That is for the blind, right? Yeah, some people is laughing here, really giggly. Yeah, it happens to me, I got stuck. I cannot. Yeah. Even in Ireland, for instance, the traffic light is noise activated. You press, and the beat gonna go faster. That means go cross. But here in Malaysia, you put fast, you put noise, nampak aja pedestrian, you're not knocked down. Have you ever come across that you cross? Okay, in front of CTC, I give you, in front of CTC, go to the Faculty of Medicine, yeah? There's a zebra crossing. How many people actually stop that yield for the pedestrian? Alah, korang pun sama je, korang naik motor kereta, lebih kurang je. No, stop. Stop, please. Right? Designated parking, this one is abuse as well, unfortunately. Okay, what is the future hold? Okay, the school, we have, you know, early intervention school. Peer pressure now, bullying at school, there's a lot. Financial, yeah, we are trying to get there, but you know financial is always a problem in medical and in dental. I'm not going to talk politics today. I'm a government servant. I'm just going to keep myself quiet anyway. So work and employment, yes, they have ability to work, but do not discriminate them. Okay? Government support, we are trying our best. Psychological support to the parents. Yeah? Now, this is a study actually saying meeting the needs of children with disability in Malaysia. You can see the paradigm shift whereby that when you do therapy for the parents, you teach them. You teach them. You're moving away then rather than giving services, you teach them. The parents were able to do the therapy at their home. Okay? Now, you know, who's this guy? You only know because he won gold medal, right? You never know this guy before. Like, we are so proud of him. We are so proud of him. Right? And all the other people that actually participated. Right? Okay, Forrest Gump. I love Forrest Gump. Yes? Forrest Gump, run, Forrest, run. I just realized that, you know, Jack Ma, one of the what do you call it, the idol is Forrest Gump. You know, Bubba Gum Factory and the shrimp. Anyone watch Bubba Gum? No, sorry, Forrest Gump. You only watch Korean K-pop thingy, and like I don't all the time. Anyway, so in conclusion, yeah, I'm nearly running out of time, am I? Yep, nearly 20 minutes left. Multiple causes of different stages of life. Helps is actually there. Multidisciplinary team approach is crucial. Perception needs to be changed. Our perception, our awareness to people. Hopes. Okay, there are hopes out there. They are our future generation. Now look at this then. The only disability in life is a bad attitude. Now, before I end, I would like to tell you a story of mine as a pediatrician. Recently happened in Hostel Sungai Buloh. Now, listen to this, yeah. I got this child. He's only 11. He's a boy. The mother has this child and a sister. In other words, then this son has a sister. This son been admitted to the hospital so many times. So many times. One day, he had been admitted with hemoptysis, in other words, then bleeding from the lungs. And he got infected, a lot of infection. When I was on call, he was very bad. Very bad. He's deteriorating. It's getting worse and worse. It's getting worse and worse and worse and worse. And tomorrow is his birthday. His 11th birthday. At 12 o'clock, okay, before 12 o'clock, he said, I asked her to call me Masri only. Yeah, because she's a kakak to me. And she asked me, doctor, the only dua I'm going to make is actually that my son passed away after his birthday. Yeah? The child is critical. Hemoptysis, pouring out blood and everything then. So, I said, okay, Akka, that's fine. We're going to see how... I didn't do anything. I didn't put any medication or anything. Yeah, I give him morphine only because I tried to comfort him. But she requested other things. She wanted her family to be here. That means her sister and also her father. And one more person. His teacher in the special intervention care. Right? 12:10, the child passed away on the mother's lap. Do you know who's crying? Me. The teachers. But the mother's acceptance is so good. The mother's acceptance is so good. Now, 11 years going through the life of looking after disabled child. Now, this child disabled because the child was jaundiced, severely jaundiced. Jaundice can be looked after by just simple phototherapy. But this child actually did not go through that. So the child actually passed away in the mother's arm together with the teacher, okay, the father and the sister. And they got a cake for him. You know, and then all I said that, subhanallah, that this mother been awarded a lot of good deeds, a lot of pahala. Simple pahala because of being patient, of being sabar, of being persistent, being consistent. Tak sikit pun dia melenting cakap kata anak aku ni merupakan seorang yang kurang upaya. And us being so perfect and everything, then kita merungut, we are complaining about things. I always tell all the stories to my wife. Absolutely, she know about this. And then we become friends afterwards. Absolutely. Now, and then let's come back then. Who are we to tell that this child is able? Who are we to tell that the mother should terminate the pregnancy? Okay? So that's my experience as a pediatrician and neonatologist. I'm sorry to actually to end in a very, very sad way in terms of my story and everything. Then this is what I've gone through. And I would like to thank everyone that attended here today. Thank you for listening. I really appreciate your attention despite there's been, some people have been narcoleptic. I let them sleep. It's okay, don't worry. Despite me walking, they don't care, And some people say, I pay for this then, and then you're talking rubbish. I'm going to sleep anyway. So I really appreciate, and thanks once again to Dr. Masri for inviting me. Okay. I said again, in our class there's 3 Mas. That's Masri, Mashita, and Masri. Yes, unfortunately though, my mom called me Mas. I'm not saying unfortunate. It's Masri, and it's fine. So 3 Masses. So that should be, a dentist, a neonatologist, and the other one Mas in Australia doing emergency medicine. Yeah, so there you go then. We are friends, right? And also a special thank to all the dentists out there, actually, Prof. Ikmal, Prof. Fuad, making me look good, smile very nicely. And of course, Dr. Ilham, looking after my children. And of course, to all of you, I really appreciate your attention. With that, I thank you.
Thank you, Ms. Chairperson, for the kind introduction. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. And a very good afternoon. Happy weekend spending your time here. The Dean and distinguished guests, participants. Thank you for inviting me. Sorry for the big hiccup this morning. I'm supposed to give the lecture this morning, but somehow I'm 24 hours behind. I thought my lecture is tomorrow. And when the organizer called me this morning, I was eating my roti canai. I said, I'm so sorry, okay? But thank God I'll still make it, okay? I'm an emergency physician from UITM, next door. For my clinical working, I work mostly at the emergency department of Hospital Selayang, right? For those of you who have been there, this is currently maybe number 2 or number 3 busiest EDs in Malaysia. Okay. We have about 400 to 500 patients a day. Okay. At the moment, as I speak, there are 25 patients in the department waiting for bed. Okay. What I'm trying to say is, some of you may have seen in the social media the different doctors, dentists, and their characteristics. Right? Have you heard about emergency physician? We have very short attention span, right? So when I'm given one and a half hours, 1.25 hours to talk, I think it's too long, because we cannot talk for more than half an hour. We are emergency physicians. Okay, we run around. Anyway, well, I'll try to make it as simple as possible. Okay, I know some of the audience not from medical background. I'll try to make it as non-medical as possible. Okay. Okay, disabilities, I won't be going this for too long. Okay, this is WHO definition is quite long. Okay, what we are trying to say is we do see them in our department. Okay, sometimes we don't realize that they are disabled people. Okay. Because we see everyone, okay. Most of them, they come to us on the trolleys, so we don't know whether they are walking or not walking, okay. Some of them are breathing, some of them are in the middle of between breathing and non-breathing, and many of them are unconscious already. So what we can see is variety, different groups of patients, including the disabled people. Okay. If you are lucky, we have some carers, some caregivers coming with these disabled people with the OKU cards, histories, so on. Okay, but sometimes we don't know who they are. Okay, we still see them as patients. Okay, So of course they have many ways of we people calling them OKUs, handicapped people, disabled people, orang kurang upaya, orang kelainan upaya, so on and so forth. Okay. But for us emergency physician, we take them as people with impairments. Their daily activities are limited, and they have participation restrictions. Okay, and they have problems in doing their daily jobs or daily activities, and it's not a simple health problem. All right. So as I mentioned, in the emergency department, we run non-selective policy. Anyone can come, especially in KKM hospitals. Okay. We cannot send them away anytime at the moment. Okay. What we do is we call it triage system, whereby we see people depending on who needs the treatment first rather than who comes first. Okay. But who's the most people who complain in the emergency department? The most well one, which are the green zone people. I think everyone has been to emergency department, right? And we have red zone, the critical zone, the semi-critical, we call it yellow zone, and the non-critical is the green zones. Okay, and this green zone, maybe we have fever center, we have soft tissue injuries, so on and so forth. And these people who are well, who are working, who are playing their gadgets, once they wait after half an hour, they start complaining. Okay? But it's okay. We put our box there to complain, and the box will go somewhere, right? What the scenarios we deal every day? Okay, we have to recognize the risk of these disabled people once we deal with them. Okay, we have a lot of challenges, regardless whether they are disabled, and more in the disabled people. We have to recognize and plan the management of the conditions in a teamwork manner. Okay, of course we are busier than other places, but we still need teamwork. Just like Justice, what's the movie now? Justice League. What dia punya line bawah tu? You cannot save the world alone, something like that, right? So we have to be team, same like us. So when we are in the, especially in trauma or polytrauma or acute emergency team, we usually think ourselves as the Formula 1 team, alright? No matter lah, Lewis Hamilton ke, Sebastian Vettel ke, any Formula 1 fans here? Yeah? Okay, they are racing in Abu Dhabi this week, right? Yeah? Or Michael Schumacher, my icon, but he's disabled now, in bed. Anyway, the one on the right is, again, I'm from Ireland, and that's the picture I took before I left Ireland. Our polytrauma team trying to resuscitate somebody, of course not disabled, but these are the way we work every day in the acute emergencies. Okay? Everybody has their role. It's a multidisciplinary, it's a teamwork effort. Okay. Okay, let's talk about things that I will talk today, right? These are all groups of disabled in their own way. Right? There are many things, but I will focus to these maybe 5 or 6 groups of this, what we call it, disabled groups, okay? And these are all not from Malaysia, right? Because Malaysia takut dia saman, I pula keluarkan gambar dia. Our problem nowadays, growing problem, more and more, is obesity, all right? And not only obesity, but morbid obesity. Very difficult to manage, no matter whether it's a emergency, medical emergencies or trauma emergencies. Very difficult to deal. But we have to accept there are more and more of these people nowadays, and we are the growing champion in this world. Okay? We mentioned just now cerebral palsy. Okay, now and then we still accept them from the institutions. They come with various conditions. Most of them is medical condition, not trauma. Of course, Down syndrome. We have a lot of disabilities in terms of their anatomy. What's this? Of course, a man with what? AS, ankylosing spondylitis. What we are worried most as an emergency physician is always airway. When you talk to emergency physician, we don't say alif bata, we say ABC, airway, breathing, circulation. Or airway is always our main concern, because we know, everyone knows, of course dentists, you know, airway can kill in minutes. Okay, 10 minutes of hypoxic brain is enough to permanently damage our brain. Okay. Down syndrome, and at the end I will talk about not really disabled, but these people can come with us with problem edentulous. Of course, you people know edentulous persons. Okay, let's talk about obesity. Okay, we are number 1, maybe number 4 in the world, but definitely number 1 in Southeast Asia. Just like our Sukan Sigat, we are champion in Southeast Asia. Of course, obesity pun we are number 1 at 44%. Okay, and it's getting more and more, right? So please know our BMI, as Dr. Masri said, get rid of our fat as much as possible. Not easy to do, easy to say, but not easy to do. Okay, so try to calculate our BMI at our own time. Okay, of course the challenges in ED is always, as I said, is airway and airway. We have problem with them with logistics and transfer. For the past 1.5 years, we have called 3 times of bomber. You know bomber? Why? Because we need to transfer patients from their houses to our hospital. Why we call them? Because our ambulance, we have only 2 people, okay? And we have small trolley. And these people are, I didn't put the picture there. These people are actually very big until our staff cannot carry them, and our trolley cannot fit the body of the patient. Okay? So what we did, we called 999, call our balai bomber, and ask them to come to help. And they come, of course, bomber, they are more sado than us, right? 5 or 6 of this abang bomber, and they call and they come with their, of course, truck. Okay, you know, lori truck bomber yang datang masa banjir, right? So they have to help us to bring these people, and of course, once they come to our emergency, of course, our trolley is also quite small, right? Maybe our trolley is for the patients up to 150 kilogram, and this guy is 208, I think, kilogram. You can imagine. So we have to combine our 2 trolleys together in our resus. And to make things worse, we had to intubate him. So it was a nightmare, right? Physical examination can be quite difficult for obese people. Investigations, getting bloods, for those, the junior doctors, remember our young days last time, okay? Getting bloods can be quite nightmare, okay? X-rays is not easy because we need to have extra big cassette or films. Ultrasound is difficult because of the adipose tissue. CT scan can be quite difficult, okay? One day in HKL, I know those who have worked in HKL, one day they had to send one patient for CT scan because he is too big to be done in the hospital. You know where they had to send him? Any idea? Any guess? Kesian nak cakap kesian. We had to send him to Zoo Negara. You know why? They have a CT scan in Zoo Negara for big animals. So until that extent, so physiological can be quite different as well, including ECGs. Those are the things that we do in emergency department once they arrive to us. Okay, so this is what I always say is the emergency physician's best view. Okay, once we want to intubate patients, the airway is the main concern. But the moment we see their vocal cords, our 90% of our anxiety will be gone. Then we say, yes, I can tube him. Then the rest will be secondary. Okay, so the challenge that we have in these people, they are difficult to, as I mentioned, to position in our trolley. Okay, they have short neck, they have large tongue, they might have distorted anatomy and landmarks. You cannot feel their trachea. You don't know where the midline is. Okay, they have large adipose tissue. It's very difficult to ventilate them, even though you manage to intubate to secure the airway, but to ventilate can be very difficult. Okay, some of our machines cannot give the enough pressure for the ventilation. Okay, the poor houseman, if we have no ventilations, the poor houseman will be crammed lah malam tu, back, because ventilation can be quite difficult. So what we do now for this kind of people, we always ask help early. Okay, call your seniors, experts. We call other people ENTs. We call the surgeons. We call, of course, the anesthetists. If this involves the oral surgery, we call one of you guys to help us. Okay, so again, airway. We will prepare extra equipments that we might have in the department. Okay, something special like our McCoy. Okay, is it pointer? Is this pointer? Yeah. Okay. This looks the same as our normal laryngoscope, but there's a tip there. The moment you push this lever, this one will go up. Okay. Then we hopefully will see the epiglottis is more clearly. Okay. We prepare things like laryngeal mask airway. Okay, just in case we cannot intubate. So LMS, this is LMS. Okay, you just sumbat je dalam in the supraglottic area, and hopefully you can ventilate them. Or things like cricosat, if you cannot intubate, you have to do surgical airway, some bougie. These are all the equipments that we will prepare if we think the obese patient might have difficulties in securing their airway. Their vital signs can be quite vague as well. Okay, sometimes they can be falsely normal. Okay, the problems we have many times is the appropriate cuff. Okay, the biggest cuff we have nowadays sometimes cannot fit properly in the obese patient. So they might give like a normal blood pressure. In fact, that this patient is hypotensive. Okay, so what we suggest to our doctors is, if we cannot get the proper cuff or proper blood pressure, you try to use the shock index. You calculate, you divide the heart rate over the systolic blood pressure. Anything more than 1 can suggest occult shock. They might be bleeding inside, because this normal blood pressure sometimes is not accurate to assess the severity that they might have. Okay, so examinations, as you can imagine, can be quite challenging. Okay, your hands can feel only to some level only, right? Difficult to elicit signs, especially in trauma. We always learn in our anatomy, in our physiology, our medical school, all right? In medical trauma, intra-abdominal injuries, they have board-like rigidity, they have here and there, but in this kind of patients, they don't have, they might have, but you cannot elicit the signs of intra-abdominal injuries. Okay. Radiological, as I mentioned, the chest X-ray quite difficult. The ultrasound, you can only see the fat tissue. The fast scan, fast scan is like ultrasound for trauma patients. We try to look for free fluids if they have intra-abdominal injuries. We might not see the signs because of the thick abdominal wall. The CT can be quite difficult. Even to transfer them from trolley to the CT, we'll need 5 or 6 people. We might not have that luxury, 5 or 6 people dealing with one patient at one time, because other different patients in our department. Okay. Other procedures can be quite challenging. Getting IV line. Just imagine getting chest tube with trauma patients with this 200 kilogram man. It can be quite difficult. To do a cryo, you might not see the neck. Okay, how can you get the cryo if they are thin like me? You can see from that distance, right? My cricothyroid membrane. But these people can be very challenging, right? So those are the challenges you might have these people. Their respiration, even though you get manage to secure the airway, their FRC is reduced, their total lung volume is reduced. Okay, they have increase in the airway pressure because of the heavier chest walls. The work of breathing will be more. They have higher incidence of developing hypoxemia. And these people, even though they can maintain their airway, they get tired more quickly to other people. So you have to have lower threshold when dealing with these patients. You have to prepare earlier than other people if they need to secure the airway. Okay. Okay, what we can do. Okay, maybe this might go quite academic, but this is just want to share with you what we do. Okay. So say this lady is nearly 200 kilograms. Okay, if you lay down a normal person, the distance or the level between their ear and their sternal notch should be level like this, so it's easier, it's higher chance for you to see the vocal cord. All right, the moment they go like this, the axis has gone that way, and no matter how much you intubate and try to visualize the airway, you won't be able to make it. So this is what we do. We stack a lot of pillows or linens behind them, so the angle will be flat like this. So it's easier for you as an intubator to open the airway and to have a look at the vocal cord before you pass the ET tube. Right. One more thing that that you might have, is you put the patient into Trendelenburg position, okay? But not many people, not many emergency department, maybe none. In Malaysia, we have the luxury of this bed. Okay, it's difficult to do. Okay, and you have, once you do this, don't forget to strap these patients. Otherwise, the patient will slide down on the floor and you'll be in trouble. You get 20 people to put him back on the trolley, right? So other consideration or abnormalities that these obese people might have in emergency department, they might have some different ECG changes, and these ECG changes might not actually picture the actual pathology of the patients. Okay? They have low voltages ECG. In normal patient, you have low voltage ECG in pericardial effusion, but maybe a false positive in this patient. They might have longer QT interval. They will have low or left ventricular hypertrophy. Yeah? So be careful when dealing with these patients. Okay. Okay, let's go to the second one. Okay, we don't see this so much in Malaysia nowadays because our population is still not beyond 75 and 80.